One disability discussed in the book Medical Aspects of Disability for the Rehabilitation Professionals is limb deficiency. Limb deficiency is the complete or partial loss of an upper or lower limb. It occurs when part of or all of a child's limb does not completely form during pregnancy, and it is seen by way of reductions in appendages like arms and legs. They do not quite grow the conventional sizes, and as a result, one grows up with a crooked foot, uneven legs, both in terms of over and undergrowth, a missing hand or phalanges, and or no limb at all. Limb deficiencies can be present since birth, or they can be the result of a certain disease, like with the example of vascular disease. Or it doesn't have to be a disease, it could be a traumatic amputation in the span of one's life, and these are most common in car accidents. The exact cause of limb deficiencies at birth is not known to be sure, although there are certain things that may increase the chances of limb deficiency in unborn children, and these include exposure by the mother to certain chemicals or viruses while pregnant, certain medicines, and the use or exposure to tobacco smoke. However it comes to be about, what is certain is that the loss or absence of a limb produces a permanent handicap. They can have devastating effects on one's self-image, care, and mobility. Treatments depend on the child's symptoms, age, general health, or severity of the condition, but overall the idea is that one is provided with an artificial limb that works and looks right. Examples of assistive technologies used in treatment include crutches, canes, walkers, wheelchairs, and prosthetics. At the most basic but essential of treatments, simply helping a child grow and develop into one who would be confident to live with who they are is good enough. In cases where limbs are attached, such as unseparated phalanges, surgery may come into play. Rehabilitation is another form of treatment, such as the occupation of physical therapy. An assistive technology is any item, equipment, or product that is used to increase, maintain, or improve the functional capabilities of those with disabilities. There are 3 types of assistive technology, and they come in the gradations of low, mid, and high. The difference in levels is meant to emphasize the sophistication of said technological equipment, but in the case of this project, low assistive technology will be used. Common examples of this level include graphic organizers, adaptive pencils and grips, visual aids, highlighters, writing things down when absent the ability of speech, walking canes, and Velcro. Above all, assistive technologies are important in bringing back a semblance of what was lost, and they help with self-image and mental well-being. One may recognize it an ill fate to not have working hands or legs like most, but with an assistive technology, at least some sort of control is retained. This is very important to the health profession. Alright, so the idea behind this low assistive technology is being able to lift without hands, or improve the muscularity of your legs without feet to perform squats. This idea occurred when I thought about how I would carry out my anaerobic exercises without the use of hands and feet. Workouts are a part of my daily life, and to go weeks and months without lifting would be akin to a little hell of an existence. And anyway, people who lack the proper limbs to exercise their muscles are prone to even worse off function of the limbs they have left. The simple act of walking or carrying anything on a regular everyday life basis is an exercise on its own, and if one was to be missing hands or feet, their muscles would be denied even the laziest of human activity. This is where my low assistive technology comes in. How it works is that if I were missing hands to lift dumbbells and work my biceps, or feet to work my quadriceps, I would have the weights tied to my forearms and onto my tibia, bound by strips of cloth. The advantages to this technology are that this only works if one still has forearms and lower legs long enough to tie and contract a dumbbell. Also, the dumbbell cannot be heavier than the cloth can hold, otherwise one will require a longer strip of cloth, or several more, to bind the weight in place. Actually, Velcro adhesives work best in this case, but of course, They will be more of an upgrade from strips of cloth. And another thing, one would have to make use of their teeth in the absence of another in order to bind these strips of cloth. Other than that, one need only require a set of dumbbells, or any kind of weight really, that they would be able to tie onto themselves. And of course, a t-shirt to sacrifice and scissors to cut. Undeniably, one will require a set of extra hands to aid in the making of this technology. So, the benefits are that you get in some strength training, which is good for your muscles. Muscles shrink most and waste away, especially if one is unable to use whatever is left of them, or even perform the most trivial of tasks, such as lifting a cup or a pencil. With this low-tech idea, you get to exercise the muscles that you still have, the muscles that you still can, and level up your bone strength.